Good evening. Good evening, everyone. Am I on? Good evening, everyone. Third time's a charm. Finally worked. If everybody can just take their seats, we'd really like to get started. We're already a couple minutes behind, and we just want to get everything organized and rolling. So if you can take your seats while everybody's filtering in, if you can all just take a moment, check your phone, make sure that it's either on vibrate, silent, or turned off. That would be great. I'll also give you probably the secret that you've all been waiting to hear, which is the Wi-Fi password. It's Ritz Conference is the network, and the password is Generali, because they are sponsoring our Wi-Fi for the conference. So let's give Generali a big round of applause, because what could we do without Wi-Fi? Okay, we're going to go ahead and get started. I am so excited to be here. This is our 9th annual healthcare conference. And for some of you who I know have been with us since the very first conference, I'm sure you'll agree that it has just grown from year to year. And every year we think we couldn't possibly have more interesting speakers or more exciting topics or more useful information. And every year at the end of the conference I reflect on it, I think, oh my goodness, we did it. And I've looked and I've had a sneak peek at some of the presentations for the next couple of days, and I can tell you that we're going to have another fantastic lineup of speakers. And the theme this year is Managing Your Health, the Empowered Patient. So my name is Jennifer Ahern. I am the Chief Officer and Permanent Secretary in the Ministry of Health, Environment, Culture, and Housing, which we affectionately refer to as HEC around our ministry. And I want to welcome you all here tonight. I want to welcome His Excellency, the Acting Governor, the Honourable Frans Manderson, the Honourable Premier and Minister for Human Resources, Immigration and Community Affairs, Alden McLaughlin. I do have apologies from the Acting Deputy Governor. She's at another engagement, Ms. Gloria McField-Nixon. She's hoping she can slide in a little bit later, but she's asked me to give her apologies just in case she didn't make it. I want to welcome my Minister, the Honourable Minister for Health, Environment, Culture and Housing, Dwayne Seymour. And we're also expecting the Honourable Minister of Education, Youth, Sports, Agriculture and Lands, Juliana O'Connor-Connolly. I want to welcome the Minister McTaggart, who's the Minister of Finance and Economic Development. Welcome, sir. Thank you for joining us. We also have our Ministerial Councillor, Captain Eugene Ebanks, who is our Ministerial Councillor for Housing and Environment. I also want to acknowledge the Chairman of the Health Services Authority, and I saw a couple of other board members here this evening. Thank you for joining us. And we have the CEO of the Health Services Authority, Ms. Lizette. Oh, there she is. I was going to say she's probably out trying to get everybody registered still. Well, welcome, Lizette. And also, I think we have some representatives from our Medical and Dental Council, our Pharmacy Council, our Nursing and Midwifery Council, the Health Practice Commission, and the Council for Professions Allied with Medicine. And most importantly, we have all of you here tonight. So ladies and gentlemen, welcome and thank you for coming. I want to thank our sponsors. We have our Premium Plus sponsor, Ironshore Pharmaceuticals, and our premium sponsors, Cayman Islands Health Services Authority, Pinnacle Media, and Tower as well. So here we are, the 9th year. Yeah, big round of applause for the sponsors. Thank you. So this year we're looking at managing your health, the empowered patient, and I'm sure that we will all find it to be incredibly beneficial, giving us some insight, knowledge, and tools that we require to take control of our health and well-being, and give us the skills that we need to communicate effectively with our healthcare professionals, and vice versa. Those of you who are in the room are the lucky ones, because you may have noticed and you may have heard that we had no on-site registration this year, and the registration filled up very quickly. So I'd like you all to give yourselves a big round of applause for being quick on the draw and getting yourself registered. Well done. As I said, Generali has very generously sponsored our Wi-Fi. That's Generali is your password. And as I mentioned earlier, please do take a minute to make sure your cell phones are either turned off, on silent, because we don't want to disturb the speakers. You've probably already had a few minutes to visit some of our exhibitors. They're scattered in the room next door and in the hallway. Please do take a few minutes to visit them. And also, if you enjoyed the cookies, make sure you say thank you, because we couldn't put this conference on without our exhibitors and our sponsors. So big thanks to all of them. And so, yes, big spank. And so now it gives me great pleasure to welcome and to introduce the acting governor, the Honorable Frans Manderson. I have to tell you, ladies and gentlemen, that we are incredibly lucky that we were able to get the acting governor to join us tonight. He has such a packed schedule, but he always makes it a priority to be with us for this conference, and so we're very, very grateful for that. So he's literally just come in from another engagement at Government House, so he slid in from there. So Mr. Manderson joined the Cayman Islands Civil Service in 1981 as an hourly paid worker with the Immigration Department. He was promoted up the ranks of the department and was appointed to Chief Immigration Officer in July 2004. During his tenure with the Immigration Department, he received many awards, including the Certificate and Badge of Honor for services rendered in the management of the Cuban migrants for the Cayman Islands, the Governor's Face Award for excellence in customer service, and he was the Person of the Year in 2006 by Cayman Net News. Mr. Manderson is an attorney at law, having completed his legal studies at the University of Liverpool. He was called to the Cayman Islands Bar in July 2004 and appointed a Justice of the Peace in 2008. In July 2009, Mr. Manderson was promoted to the post of Chief Officer in the portfolio of Internal and External Affairs. And in 2012, the Governor, in consultation with the United Kingdom Secretary of State, approved the appointment of Mr. Manderson as Deputy Governor and Head of the Civil Service. Mr. Manderson is responsible for the management and performance of the Civil Service, which has a budget of over $500 million and approximately 3,700 staff. He is also a member of Cabinet and is the first official member of the Legislative Assembly. In June 2018, it was announced that he was awarded an MBE by Her Majesty the Queen. Mr. Manderson is married to Nuvia and has 2 children, Alyssa and Frans Jr. Ladies and gentlemen, please join me in welcoming the Acting Governor, His Excellency, Mr. Frans Manderson.
Good evening, everyone. I know that protocol has been established, but do allow me to recognize our Premier and my Cabinet colleagues and my daughter, who is here in the back. So, as Ms. Ahern said, I just left Government House, where I was having some very British tea with some of 5 of our amazing young Caymanians who have been awarded and recognized for the work they've been doing in the community by our Young Caymanian Leadership Awards program. It was inspiring to listen to them talk about what they have done to make the lives of so many people better. So I want to welcome you to the 9th Annual Cayman Islands Healthcare Conference. I thank the many generous sponsors that make this conference such a success year after year. I congratulate the Minister of Health, the Honorable Dwayne Seymour, Chief Officer Jennifer Ahern, and all who had a hand in bringing us another stellar event. And Ms. Ahern is absolutely correct. I do make an effort to be here every year, because I really do believe in this conference, and I want to thank the Minister for his passion and his commitment that he has made, and all the sponsors who actually make this a free event. We don't have too many free conferences. I also thank and welcome our local and international healthcare providers and presenters who have put aside from their busy schedules to join us for the next 3 days of managing our health, the empowered patient. And I welcome those attending this conference that have traveled from overseas. While the agenda is packed with interesting and informative information, I do hope that you will find time to offer and to see what we have to offer, from our sugar white beaches to our genteel people. And I just come from Government House, which is on the beach, and I can guarantee you the sand is absolutely sugar white today. And it will be there tomorrow if you get to visit. As always, this conference is not just for healthcare professionals, because there is something here for everyone. It is my hope that at the end of these 2 days, each of you walk away with something that you can take on board to become more empowered as you work with healthcare professionals. Over the years, the discussions at this conference have led to a number of new initiatives, policies, and legislation. One example that is very near and dear to my heart is the Deputy Governor's 5K Challenge, which many of you in this room have taken part in, which came as a result of an idea from Ms. Ahern here after she attended a conference back in 2013 with the theme, Taking Care of Business, a Shared Approach to Workplace Wellness. So since that conference and since we saw the importance and became aware of the importance of workplace wellness, we in the civil service have worked very hard to ensure that our staff have access to wellness activities. So in addition to the DG's 5K, we're having a sports day tomorrow, and we also have our Run Walk Club. And that has really made a difference in our staff, health of body, health of mind. Myself, I have tried to take part in as many of the activities as possible. Since 2012, and up until on Friday, I'd actually taken 1 sick day over that period of time. And that is as a direct result of a change in lifestyle. But the DG's 5K has been very successful. Just this year, we've raised $8,000 or $9,000 that we gave to 5 charities, mostly involved in feeding our elderly and our shut-ins and our children who were not able to access food at schools. Over the last 5 years, we have raised close to $300,000. Again, that idea came from this conference. And we have certainly made a difference in our community. We have purchased a new ambulance. We have helped construct the hospice new building. We have given money to our Special Olympic athletes. We've done a lot. The YMCA has now built a ropes course as a result of the money given from the Deputy Governor's 5K Challenge. But last year was very exciting for me. I attended the conference, and the theme was Food for Thought, exploring the relationship between nutrition and health. And Dr. Ruder, who is called the foodie physician, convinced me that it was possible to eat healthy all the time. In fact, she introduced me, and this is true, you can go onto our website and you'll see it, sweet potato pancakes. I went home and I tried them, and they're absolutely delicious. So it really proved to me that if you put some effort into it, all of your meals can be really healthy, and you will improve your health. Folks, I want to thank all of you for attending here this evening. Again, please do applaud our sponsors who help make this a free event every year and a very successful event. To the many residents who have attended, thank you for coming. Again, Minister Seymour, Ms. Ahern, and the wider government, thank you so much for investing in this conference. You have certainly made a difference in people's lives. Thank you very much.
Thank you so much, Acting Governor. Now, if you're following along in your program, you'll note that we actually had the Honourable Premier down to speak tonight. He had, unfortunately, a conflict, which then resolved, and he's now here to join us, but he's assured me that he's quite happy to just take it in. So, Premier, I'm glad that you were able to come, I'm sorry that you weren't able to speak, but I do appreciate with the late change in plans that you did make it here tonight. So thank you, sir. So the next speaker that we have is the Minister of Health, Environment, Culture, and Housing, the Honorable Dwayne Seymour. Dwayne John Seymour is a businessman and a philanthropist who grew up in the beautiful first capital of Boddentown, Grand Cayman, and at a very young age, he learned the significant value of hard work and dedication to the community. Mr. Seymour has been involved with Boddentown Football Club for over 30 years. He served as captain and coach and is currently the vice president, and he has also been the chairman of the Commonwealth Youth Parliament. He has a keen interest in entertainment and has organized and sponsored many musical talent shows for up-and-coming singers, and in particular, an event called Exposure, identifying rising stars. Minister Seymour enjoys mentoring the youth and empowering them to believe that everything is possible once the work is put in and you have a positive attitude. Mr. Seymour has 33 years of experience in the airline and aviation industry, including aviation security. He was the National Flag Carrier's regional and international airline manager and is a highly certified aviation consultant and trainer. He single-handedly developed airline security as a local career and takes immense pride in always having more than 75% Caymanians in his employ. Mr. Seymour is the president and CEO of Airport Professional Services, known as APS, for the past 17 years, which operates in Grand Cayman and Cayman Brac. He has served on many boards, including the Prison Inspection Board, the Health Insurance Commission Board, the Status and Permanent Residency Immigration Board. This is Minister's second term in office. The first was 2009 to 2013, and he's been fortunate to serve in cabinet both times. Mr. Seymour is married with children and attends the Webster Memorial United Church in Boddentown. Ladies and gentlemen, please welcome the Honorable Dwayne Seymour.
Good evening, ladies and gentlemen. I am delighted to welcome everyone to the 9th Annual Cayman Islands Healthcare Conference. I want to say before I continue with my presentation that when the speech was printed, I looked at it and called my PA to see what was wrong. There were some letters missing. And in case you hear me make any mistakes tonight, she told me that there was a problem with the printer. It wasn't printing A, E, I, O's, and U's. I also want to say that I also attended the DG's 5K, and I passed everyone. I was walking as fast as I could, passing everyone, and me and my wife, who is here today, give her a round of applause, Tiffany. And the sad thing about it is that I couldn't walk for days after. But I want to give first the former Minister of Health, the former Minister Mark Scotland, who was the architect of this event. Give him a round of applause, please. And it couldn't go without saying the Premier and the unity government has been so supportive, and they must be praised for their support in a very massive way. Give them a round of applause, please. Yeah. It is hard to believe that we are almost a decade into this healthcare conference, a conference which grows from strength to strength each year. making it one of Cayman's most anticipated annual events for healthcare professionals and the general public. As Minister of Health, I am pleased to officially welcome the 1,200 people who are registered for this year's event over the next 3 days. I also want to say that the 1,200 people that registered, if you could see me after, I am trying to set up my campaign run for 2021. And if you could respond so fast, I think you could help me. I also wanted to make special mention of someone who came all the way down from New York, former senator in New York, the Conleys, Truman and his wife. I want to welcome them to Grand Cayman also. Give them a round of applause. Yeah. This year, we made a tough decision to cap registration numbers and remove the usual on-site registration. While this wasn't an easy decision to make, we believe it was the right one. Our aim, as always, is to provide a high-quality conference that can be enjoyed by all in safe environment. I would like to remind attendees that all presentations and content shared over the next 3 days will be available on the Healthcare Conference website within a few days after the conference has ended. If you have any colleagues, friends, or families who were unable to attend today, please share this information with them. This content is free to access online and available for everyone's benefit. Of course, none of this is possible without the ongoing support from our sponsors and healthcare providers, both local and international. We are grateful for their ongoing commitment and, more importantly, the time they've given us in order to make this conference successful and interesting for our attendees. We are also pleased to announce that Ironshore Pharmaceuticals and Development, a local company, has come on board as our Premium Plus sponsor. Give them a round of applause, please. This year's theme, Managing Your Health, the Empowered Patient, will surely be beneficial in providing you with the insight, knowledge, and tools required to take control of your health and well-being and give you the skills you need to communicate effectively with your healthcare professionals. For medical professionals, we are pleased to give you the platform to share the latest advances in your medical fields, and now these are contributing to the subject of patient empowerment. Not forgetting, of course, that professional aside, we are all, in fact, patients or future patients, so we can all learn something here over the next 3 days. All consumers of health care, we must advocate to get the very best medical care possible. We must be vigilant, educated, and listen to our bodies. Health care must be a dialogue and partnership between healthcare professionals, patients. This conference aims to provide the tools, help, and support to get patients informed and involved in all phases of their treatment and care. This is what patient empowerment is about and is an excellent way for us to take responsibility for our health. The conference will cover wide-ranging topics such as day-to-day management of the non-communicable diseases, understanding when health symptoms indicate a trip to the emergency room, as well as developments in technology and its impact on healthcare in Cayman, all with a focus on patient empowerment. I encourage our attendees to proactively engage as much as possible in order to fully benefit from the expertise we have at the conference. Among our interactive presentations, we also have our breakout sessions, which will focus on taking care of the elderly and managing cancer follow-up care. Two subject areas that are very relevant to the Cayman Islands community today. In the Cayman Islands, the top cause of death are cancer, cardiovascular disease, and diabetes. Again, all health issues that occur predominantly but are not limited to the elderly. Speaking on elderly care, we are reminded that this month is Older Persons Month, for which the Ministry of Community Affairs provides a range of community events and activities. For the next 3 days, you will hear from some of the most respected healthcare professionals in their fields about the latest advancements in healthcare and how these advancements are improving how patients can manage their health. We will hear about how the cost of healthcare is being managed more effectively and how this is benefiting patients. We will hear how technology is allowing patients to better control their healthcare plans. And we will also hear some interesting tips and techniques along the way that can be easily applied to the empower you take control of your own healthcare and well-being. But while it is beneficial to empower yourself, it is equally important to be aware of how you can empower others. With that in mind, we are pleased to include speaker presentations that focus on how parents and caregivers can be empowered when it comes to dealing with illness in children, pediatric health care, and the elderly care. I'm also pleased to see so many of my own ministry staff in attendance, as well as delegates from our ministries. I really cannot overstate how important this conference has become, not only to my ministry but to the Cayman Islands community and the healthcare community near and far. Over the past 9 years, we have seen some strong partnerships forged in business and some inspired actions taken by the local community, which would not have come to life if it had not been for this conference. Having such a strong network of partners means we are able to fulfill our main mission, which is to reach out to as many residents of our island as possible to help offer them solutions to improve their health and well-being. Finally, to each of the sponsors, contributors, speakers, and partners, on behalf of the conference organizers and the Ministry of Health, we offer our sincere gratitude. I also thank the public sector, the private sector, and the charitable organizations that have worked together to make this a truly collaborative effort. Once again, welcome to all our attendees, and I hope you enjoy our packed agenda. For those who have traveled especially to be here, please take some time to enjoy all that we offer, from our pristine beaches to our wonderfully kind people. I want to say in ending, they care what you know only when they know that you care. Welcome. Thank you, and God bless.
Thank you so much, Minister Seymour. Our next speaker is Mr. David Licorice, who is the co-founder and CEO of Ironshore Pharmaceuticals, Inc. And they are, as you've heard, this year's Premium Plus sponsor. Can we please give them another round of applause for that? So David Licorice is the co-inventor, the founding shareholder, and the chief executive officer of Highland Therapeutics. Under his leadership, Highland has grown from a startup company founded in the midst of the financial crisis to an international pharmaceutical company with a proprietary drug delivery technology and 2 late-stage drugs under development. Licorice studied microbiology and finance, it's an interesting mix, at the University of Guelph in Canada. He graduated with honors and received his Bachelor of Commerce in International Economics and Finance. Mr. Licorice has been a CFA charter holder since 2001 and has worked internationally covering the global pharmaceutical industry as Senior Vice President of Equity Research. Ladies and gentlemen, please welcome David Licorice.
Thank you. Good evening, everyone. It's nice to see so many people out here, unless you're a nervous talker like I am. So bear with me, and it's certainly very difficult acts to follow. I must say it is particularly heartwarming to be here tonight and see so many people coming out and taking an active interest in their own health and well-being. One of the most important things you can do for yourself and for your loved ones is be an active participant in your health care. Working with physicians and the incredible amenities that we have on island can help you do that and be as the best you that you can possibly be. I want to reiterate, my own appreciation to the Cayman Islands government, to the various sponsors, to the Minister of Health, and all of the participants here today. I know in particular, having had the opportunity to work with the organizers, all that goes into putting on an event like this, and I can tell you that they're working late night and day. This is the 9th annual event. Iron Shore Pharmaceuticals has been privileged enough to participate as a sponsor for many years. We certainly have made it a priority and in our own small way do what we can. This is our first time stepping up to the plate as a premier sponsorship, and we hope to do that again next year. This year the theme is about patient empowerment. Tomorrow morning you'll have a chance to hear from Dr. Randy Salee, Iron Shore's Chief Medical Officer, who's traveled from South Carolina to be with here today. Dr. Salee is board certified in psychiatry, child psychiatry, and clinical pharmacology. He's authored over 100 articles in distinguished academic journals, including the American Academy of Child and Adolescent Psychiatry, the Journal of Clinical Pharmacology, the Journal of Attention Disorders, and the Journal of Neurology. During his very prestigious career, Dr. Salee founded the Pediatric Pharmacology Research Unit at Cincinnati Children's Hospital and served as vice chairman in the department and division chief of head of psychiatry in Cincinnati Children's Hospital Medical Center. Dr. Salee's talk on mental illness in children, empowering patients, caregivers, and healthcare professionals will be important and relevant for all of us to hear. Mental health can be very difficult to diagnose, and parents may not know how to differentiate between when a child is going through growing pains and when there's something more serious underlying those conditions of a clinical nature. Being empowered about how to approach that discussion with your child and with your healthcare provider is very important advice that we'll all benefit from. To put the challenges in context, consider for a moment that in the United States, suicide is the second leading cause of death among people the age of 10 to 34 years old. 38% and 24% of adolescent girls and boys, respectively, will face clinical anxiety during their teenage years. And I suspect that this will only increase as we continue to use these modern inventions, social media and handheld devices, having seen the opportunity, or having had the opportunity to see how it impacts young people today. Certainly many of us in the room didn't have to deal with those stresses. Anyway, just like the health of the beautiful reefs off the Cayman Island shores, those beautiful reefs are very much a product of their environments. And without the pristine water, we wouldn't have the pristine reefs. In contrast, that online environment that these kids deal with can be a toxic and very dangerous place. As the CEO of Iron Shore Pharmaceuticals, I believe we have a role to play in improving the health of the environments in which we live. And I'd like to make a little announcement to that in a few moments' time. As you may have seen, Iron Shore Pharmaceuticals recently retained FDA approval for a product called Jornay PM. It's a novel formulation of a drug used for the treatment of ADHD. ADHD affects 10% of children and 5% of adults, meaning it is amongst the most common and most treatable of all psychiatric conditions. Again, I believe very strongly that we have a role to play in developing healthy environments, and we want to help to make sure the medications are made available for those that could benefit from treatment. So I'd like to take the occasion today to announce our intention to renew and expand our commitment to the people of the Cayman Islands. Currently, Ironshore is actively exploring ways that we can import this important new product, and we intend to make sure it's accessible for everyone that could use it. That would mean making sure that the drug is being priced at a socially responsible price point, one that ensures appropriate use of the drug, but keeps it within reach of patients. In addition to making the drug affordable, Ironshore also intends to invest a significant amount of the profits from the sale of the product into locally Cayman-based charities that do so much to help enhance our communities. We're in the early planning stage. As I mentioned, I hope next year we'll be able to come back and talk to you about some of those important details. But let's please continue to talk about mental health issues with your loved ones, and don't hesitate to contact someone if you ever feel like you need help. The Ironshore team is here. Dr. Salih is here and speaking tomorrow morning. I hope you take the opportunity to say hello to all of us. Thank you again for taking time out of your busy day to be with us. Thanks again to the Cayman Islands government and the organizers who put this conference in place. Thank you.
Thank you so much. That's a very exciting announcement that you'll be donating your profits to some of the local community efforts. That's fantastic. So now we have our keynote speakers for the evening. We have Dr. Gary Sibbald and Dr. Mariam Botros, who is the CEO of Wounds Canada, and they're going to be talking to us tonight about what it means to be an empowered patient. Dr. Sibbald is a dermatologist and internist with a special interest in wound care and education. He is a professor of medicine and public health at the University of Toronto and an international wound care key opinion leader. He's an educator, a clinician, and a clinical researcher. Dr. Sibbald is co-founder of the Canadian Association of Wound Care and was the former director of the Wound Healing Clinic at Women's College Hospital. He is also past president of the World Union of Wound Healing Societies from 2012 to 2016. In 1999, Dr. Sibbald co-developed the International Interprofessional Wound Care course and has been the director for 31 courses worldwide. He has over 200 publications and is co-editor and chapter author of the Chronic Wound Care 5 textbook. Professor Sibbald received the Queen Elizabeth II Diamond Jubilee Medal in 2013 and an Honorary Doctor of Science from Excelsior College in 2014. Dr. Botros is the Executive Director of the CAWC, Canadian Association of Wound Care. She is a chiropodist at Women's College Hospital Wound Healing Clinic, a clinical director of Diabetic Foot Canada as well. She is co-director of the International Interprofessional Wound Care course at the University of Toronto and has lectured on programs internationally in the area of diabetic foot complications and amputation prevention. Mariam brings the practical and professional experience to be effective in her leadership, which is gained from her roles as an executive director, a healthcare practitioner, a healthcare educator, researcher, and faculty member for many well-recognized organizations. Tonight, Dr. Sibbald and Dr. Botros will be talking about what it means to be an empowered patient. Please give them a very warm welcome.
Thank you, Jennifer, and thank you for the invitation to this meeting. What are we going to do in this session? And in this session, we're going to look at type 1 and type 2 diabetes, the challenges of a person with diabetes, but also with a complex wound. We'll assess the key components, and to some of you, VIP means very important person. But to me, and to people with diabetes, it's vascular, infection, and pressure. We're also going to review methods, and Miriam's going to talk about methods to support patient empowerment and improve healthcare outcomes. Well, the incidence of diabetes is increasing. And when we look at this increase, it's astounding. 75% of the people with diabetes now live in the low and middle income countries. We're going to see the incidence go from 365 to 552 million individuals. And you already heard it's the fourth leading cause of death. And with cardiovascular disease being the third most common, I think we have another thing that we really need to look at in terms of looking at these individuals. When we look at the Narayan principles, and these are very important, especially to patients, but also to healthcare systems, because there are three simple measures that can actually save healthcare dollars, but improve patient outcomes. The first is looking at foot care if high risk, and we're going to show you how to do that. The second is glycemic control for a test that I'm going to talk about called the hemoglobin A1C that measures your average blood sugar over 90 days. And in Canada, we're looking at a level of around 7%, not 9%, and blood pressure control less than 160 over 95. But we know anything over 120 over 80 is actually associated with an increased incidence of strokes. What is hemoglobin A1C? The average red blood cell stays in the bloodstream for 90 days. And depending on your level of blood sugar, you actually get sugar deposits on the surface of that red blood cell. So what this test does is to measure the number of deposits, so it can actually tell you for 90 days what your average blood sugar was. The higher this level, the greater your complications in terms of a person with diabetes. Now, to remember things, I like mnemonics. So here's a mnemonic that goes from A, B, C, D, E, F to S. Hemoglobin A1C is the beginning of the diabetic scenario, a high blood sugar. But it also relates, the metabolic syndrome of type 2 diabetes relates to blood pressure, high cholesterol levels, diet, and we look at our body weight, exercise. If you exercise for 30 minutes, 5 days a week, cardiovascular, walk on that beautiful beach, and you do something strengthening a couple of times a week, you can actually decrease this level by 8%. But there aren't too many people, I'll tell you, that do it just based, if you like, on exercise. And many of us need, or persons with diabetes need drugs like metformin. And you see the other drugs listed here, the ACE inhibitors, the ARBs, the statins, and the aspirin. F is for foot care. And foot care is the most common and the most costly complication of diabetes and smoking. Let me just plant one little comment that every cigarette decreases the circulation 30% for an hour, and it increases sympathetic tone for 8 hours. So if you're a person with diabetes prone to cardiovascular disease, it's like a double shotgun or a double indemnity. So you've really got to be careful. So let's introduce type 1 diabetes, which really has those same risk factors, but this is insulin-dependent or juvenile diabetes. It's less than 10%. It's a chronic condition. The pancreas is producing little or no insulin, and insulin is a hormone needed to allow sugar to enter the cells and produce energy. Throughout this presentation, we're going to use one patient, Helen, to illustrate the principles. She was born in 1950, so she's really the generation that is getting into their senior years, their sandwich generation, and she's now 68. In 74, she was diagnosed with type 1 diabetes, and in the video, you'll hear in 81, her first foot ulcer developed. In 85, she was admitted with osteomyelitis of both small toes and really recommended they be amputated. In '87, she had a foot ulcer over the forefoot of her left foot with osteomyelitis, and it was recommended to her that she have her forefoot taken off and she should just get on with her life and not spend this time in the hospital. So if we push it again, I think Helen's going to talk to us.
Developed diabetes in 1972. I must have had the symptoms for at least 6 months prior because I inexplicably started losing weight and was very happy about it. And my brother, who's a doctor in Montreal, told me to go to a doctor and get it looked at. And I said, well, just another 5 pounds. Anyway, I went before the 5 pounds and I was diabetic.
What happened in '81?
In '81, I went for, I was sitting and sort of playing with a corn on my baby toe, and all of a sudden, there was like an explosion, huge ulcers, and then the second toe, the other baby toe also developed an ulcer, which I really don't know how. And Dr. Sibbald treated it for a couple of years. And then, well, I guess 4 years, because in '85 I had to be hospitalized and the toes were to be amputated.
And what happened instead?
Luckily, Dr. Eyston wasn't a very good gin player, and he decided he would try something else. So he removed the infected bone and left the toes intact, physically, cosmetically intact. And after 8 weeks in hospital on intravenous antibiotics, I left the hospital with all my toes.
And in '87?
In between '85 and '87, I developed an ulcer on the forefoot of my left foot, and it became infected. I developed osteomyelitis again, was hospitalized and advised to have the front of the foot removed and just to carry on. With Dr. Sibbald's support, we didn't do that. I was in hospital again for 6 or 8 weeks on intravenous antibiotics and left with both feet.
And 33 years later?
33 years later, I'm still doing grocery shopping, running to clients, running to family, and going on trips.
So you heard Helen, you heard her story. And when we look at Helen, all of a sudden she's diagnosed with chronic disease. You know, all of a sudden your life changes. You're expected to do all of these things that are listed here. You know, you're supposed to look after your weight, your medication, your lipid controls, everything. Your renal disease, your feet, you're inundated with everything under the sun. Put on top of it, bad luck, you may have all this guilt within you. You also have to take care of your mortgage because that doesn't go away. Your kids' college fund is still there. You need to manage time off work because you're ill. And then you have to take work home because maybe you're not able to juggle it. And then you have a relationship strain. There's no doubt chronic disease or any type of illness puts a strain on our relationships. And guess what? On top of everything else, you get told you're not doing enough, whether it's from family members, whether it's from the medical field. So really you can relate. How many people in the audience can relate to all of this? Any takers? Right? We all have gone to it. We can relate to this. So usually the patient experience is when they're diagnosed with chronic disease, many of them feel quite overwhelmed. You know, they feel a loss of control. And control is the key factor. All of a sudden, your life has changed and you've lost your control. And then you feel immediately that you can't control many of the decisions. A lot of the decisions are being made for you. and you're ill-prepared to take part of the decision-making. That is a problem. And then, of course, on the other hand, you find us, the healthcare professionals. We're the doers in your life. We just want to fix it. So we get in there and we tell you how to do it. And you know what? That's the perfect storm, and we're going to find out why. So there's a question for you. We want this session to be quite interactive. We want you to be talking to us and to talk to each other. So let's reflect for a few minutes. What are some of the possible reasons that you would think somebody who has illness undergoes loss of control, frustration, or experiences fear? So any takers from the audience, Dr. Sibbald will be bringing the mic to you. What are some of those possible reasons?
But I'd like you to, yep, go ahead.
Sometimes the patient may not understand exactly what has happened to them. They may not understand the process of the disease, and they don't understand what they can do to help control, manage, reverse the disease.
Now, you're the only one off the hook so far.
I think,
Keep talking.
okay, I think that often it's very difficult to navigate the healthcare system, to know where to look, where you can actually find help.
So I want each of you to think of one reason, one cause, and I want you to relate it to the person next to you. I want you to tell whatever you've got your hand up for, tell it to the person next to you. I'll come back to you. But I want every one of you to think of a reason and to talk to the person beside you. I want one comment, and then I'm going to get everybody to put their hand up for a person that didn't talk to them. Okay? And I'm going to come and talk to you. Okay, so just say something to the person next to you. One reason. I want one reason. Okay? One reason. Oh, I see some non-talkers here. If you want my mic, I'm coming. Yeah. Miriam, that's a pretty good discussion.
Yeah. Yes.
Now, there's one person I cut off, and who had their hand up? The hand's gone. Okay.
All right.
But I think you probably have come up with several reasons. Miriam, tell us the answer.
Yes. So from literature, we know that there are lots of reasons why patients feel that they've got loss of control. I think one of them is maintaining their meaningful life roles. That's a big factor. All of a sudden, there's a big change. Change is a big stressor in our life, whether positive or negative, so let alone when we've got a new diagnosis. Coping with fear, anger, frustration, sadness are all emotions related to chronic disease. Accepting disruptions in the routines. I know patients that refuse, that initially when you tell them there's a change in routine, it's almost like a rebellion. We don't want to do this. Why do we have to reorganize our whole routine to accommodate all of this? You know, I don't deserve this. I deserve better. Confronting their own mortality, that's a scare. You know, when they get scared, they go into denial. Adhering to the different described therapies, and also adjusting to the new lifestyle. This is going to be our new normal. We're going to have to be taking daily medications. We might have to change our activity routines. All of those are reasons why patients all of a sudden feel a loss of control.
Now, Helen is fond of telling our clinic staff that she's known Dr. Sibbald longer than either of her two husbands. And so this is a little story that a week or so after it happened, she told me. Let's listen. Go.
After leaving the hospital in '87, I was going to the ballet and leaving straight from work, but the ballet, I kind of wanted to wear a nice, very conservative pump. And I did. I had my orthopedic shoes in a tote bag and asked my friend to be on the lookout for Dr. Sibbald because he had mentioned he was going to be there that evening as well. And she agreed to do it. There was one problem. She had no idea what he looked like.
So obviously, Helen, another thing that you notice about Helen, our patients want to please us. They will do things just to please us. So obviously what we're seeing from Helen right now, she hasn't bought into the concept. She just wants to please Dr. Sibbald. She wants to avoid, getting into further interactions. Yes, Dr. Sibbald?
I want them, go back.
Oh, sorry.
I want them to look at their shoes right now. I want you to look at your shoes, and I want you to decide if they're too small or not. Look down and look at your shoes. You know what your foot's like, but you can go home later and let's see. Keep going. How do you tell if your shoes are too small, Mariam?
All right. So the problem with diabetes and why we focus on shoes is a lot of our patients lose sensation in their feet. So they can never tell if the shoes is too tight or too big. Sometimes they buy shoes that are too big because they think that way they won't get any sores. And many times they wear shoes that are too small because when they're small, they give them a feeling of stability. So because they've lost that biofeedback, many times we say, okay, we tell them, change your shoes. They say, well, my shoes are fine. We say, okay, let's see if your shoes are fine. So what we do, we get them to draw their foot. So we say, stand up, let's draw an outline of your foot. And so we draw it. And then we take the shoe and we draw it within that structure with a different color. And they can see many times that their foot is too big for the shoe. So the
and
shoe's
look at
obviously
those
too small.
toes sticking out in the side of the foot. And if the shoe is too small, you get a callus. A callus means too much pressure. And if you get a blister, it's either friction, the foot's moving because maybe the shoes are too big, the foot's moving against the sole of the foot, or you get shear. The bone moves in one direction and the skin moves in another. So you need properly fitting shoes. And a person with diabetes should always get their shoes fit about 3 in the afternoon or after the swelling has occurred.
So that's the problem with Helen. She thinks her shoes are fine, but yet they're too small and putting her at risk. But she wants to avoid Dr. Sibbald. So patient empowerment. A lot of times many times we feel we're going to empower that patient, but let's look at the definition and see if we actually have the ability to do that. According to the World Health Organization, empowerment equals patients that have greater control over their decision and actions that affect their health. Patients should really be in control of their own care and behavioral changes. They're in control. We're not as healthcare professionals. And so if they're in control, there is more adherence to the need for self-change. They can identify what changes needed to be made, and they can work with us to make them. And it all goes under the self-determination theories that individuals are naturally motivated to improve their own well-being if they identify it. So that's the definition around patient empowerment. And why is empowerment important? That's another question that we'll put out to you. Why do you think patient empowerment is important?
Okay, as long as you're talking to your neighbor, I'm not going to come with the microphone. I'm looking for the first person that I see that isn't talking to use the roving microphone. Talk to your neighbor. Why is empowerment important? Okay. Okay, is there anybody that wants to share a particularly enlightening comment that they got from somebody? Anybody want to volunteer a comment? Oh, there's one over there. You're closer. Thank you. I have a microphone helper.
Each person knows their own body and their own self. No one else knows them more than the person itself. So that's why you're able to tell and explain to the doctor your feelings and what you think would be best for you. That's how I see it.
Excellent. And you know what? I think that's going to reflect what you're going to tell them.
Yeah. So these are some of the cited benefits of empowered patient. They are better at making decisions. They have better relationships with their healthcare professionals. They're more committed to adhering to the plans because within themselves they've identified these factors are important. They're willing to take responsibility. They can take more preventative actions to avoid complications. They know where to seek help, so that navigating the system. And then overall, it's more cost-effective for the healthcare system. So an empowered patient is a very valuable patient for everyone, for their families, for themselves, and for our healthcare system. So really where we want to take you is empowerment cannot be achieved unless the patient themselves internalize the needs of self-change. We cannot give them an IV injection of patient empowerment. They have to do it for themselves. You cannot empower anyone unless they want to do it. Empowerment is not a technique, it is a strategy. It is a vision that guides the interactions that we have with our patients. And it needs to be quite the mind shift for many of us clinicians. It's from doing things to our patients to taking a step back and becoming their coach, doing it with our patients. So another question that we have for you is, can you make any suggestions for healthcare professionals that would increase patient engagement in their care?
What would you like to say to that professional that just shrugged you off or really annoyed you? So just think, how could the healthcare professional work in a way that would be more beneficial for you? So I'm coming to look for my victim. Talk to your neighbor, come up with a suggestion. Where can I find? And you know what? This far side is less active. They think they have escaped. They haven't. They better be talking. What would you like to tell us? You have to talk to each other. Come on. I even see the finger engagement here. That's good. Anybody want to volunteer something that they've heard right in front of you? Yeah, let's hear. Okay, go ahead.
Good evening, everyone. I'd just like to tell all the people that have diabetes or has just been diagnosed with diabetes that I've had it for 30 years. And you know what? Nothing goes that says you have to get your legs amputated, you have to get your this gone and the next one gone. You just have to be committed to being the best person you can handling it. And bear in mind that sometimes it's not going to be just where you want it to be, but you're going to give it your best shot. Good going, guys.
Thank you.
So these are some of the views from a patient perspective. Provide a vision for the future. Give them hope. You know, life does go on beyond that diagnosis. Add some fun. Try to make it fun. You know, if you're going to eat healthy, we heard from the minister, we can find great recipes. So we heard it earlier. Turn it into a fun. Healthy living can be fun. It's not the end of the world. Engage the patient in providing input into the healthcare plan. So it's really important that we're doing a healthcare plan together, that us as healthcare professionals are not just giving the patients the plan. Assist in developing joint goals. Develop measurements. So what you'll see is usually our patients in the wound care clinic, they can remember their measurements. When we measure their wound, they're like, Mariam, last time it was 1 by 1 centimeter. Maybe this time it's 0.5 by 0.75, and we celebrate those successes, so identifying the measurements. Promote social interactions among the patients. And I always say some of the greatest learnings that happens in our wound clinics happen in the waiting room. They share and they connect, and then they provide some kind of social support outside the clinics. So ask questions and listen to our feedback. That was very important from a patient perspective. Provide encouragement. You know, again, that's very important. You can do this. If somebody looks you in the eye and tells you that you can do it and helps you in figuring out, that'll be a lot of engagement. So those were some of the feedback that have been cited in literature. Going back, yes, go ahead, Dr.
No, and I mean this whole word adherence is more from a patient's perspective. And if you look at the definition, it's to follow through on a treatment or regime. One of our nasty words is compliance. And compliance means to obey an order or command. And that's very healthcare professional oriented and not patient oriented. And look at those flip-flops. I think in Guyana they're called rubber dinghies, but you know, they really put that strap, Mariam, where the most harm's going to occur, and there's no support for the feet.
There's no support, so that's not quite supportive for sure. And we know, to take for an example, the patient's non-adherence can be a major factor in the reason why diabetic foot ulcers fail to heal. And we know that from a lot of the studies that the majority of the diabetic foot ulcers, patients were not adherent to the offloading, and they only wore their special devices only 28% of the time. And the way they detected that 28% of the time is they put a secret pedometer in their cast. So the patients wore the cast to the clinic. They tried to please their healthcare professionals, like Helen tried to do with Dr. Sibbald, but yet the majority of the time that cast was off.
So if that's in a clinical study, what do you think happens in the real world? Next. Here's Helen's challenges, and Helen was the very first person with diabetes I saw with red shoes. So the first red orthopedic shoes were Helen's. And I think at age 35 in 1985, the amputation of the toes was because those little toes were squeezed into her pumps, which she was sometimes wearing and admitted. And it took time for her really to be ready for the change, which was drastic. You know, she was in a big accounting firm. And, you know, the bones were removed and she escaped the bullet. In '87, the osteomyelitis, the metatarsal heads, a senior consultant came along and said, Helen, you're back here so soon already again. Just get your foot chopped off and you'll be out of here in a week. Well, you know, and that happens. In many of the projects I've been around in the world, I'm the policeman. I sit between the clinic rooms and, you know, somebody says, Sibbald, get your ass in here. They're going to take a toe off. And that's my job, is to save toes.
So certainly there are a number of strategies and techniques that are available for healthcare professionals to introduce patient education and to motivate patients, because that's what we can do, that's the role that we can do, linked to patient management, to help them internalize the need for change. We can implement certainly collaborative discussion models to introduce strategies to help them problem solve. We talked about problem solving and setting future goals. And I think, Dr. Sibbald, you like the Keller and Carroll.
Yeah, I do.
method.
And it's another mnemonic, engage. What do you know about your patient that's something other than their medical problem? They've got a wedding coming up, they've got a christening, etc. And I have a method of writing it in the corner of the charts till all the rest of my staff have figured that out as well. Empathize with the patient, you know, show real concern. Mm-hmm. Then you educate them, but then you really need to enlist them. You need to negotiate something that's in between your beliefs and their beliefs that you're both comfortable with.
And adding to that, one of the things that one of Dr. Sibbald's patients said to me, and it struck me once, is, you know, he sees me beyond the wound. So he sees that patient as a person, not as a disease. It's really important to articulate that to our patients. And really, behavior change is difficult. No one is going to tell you it's an easy journey. It is difficult. And most individuals will need support. But, you know, there are stages that many of us can go through. And I love that image, and I hope it's clear, is that we all go through stages. At one point, we're not even thinking about the problem. And then we move forward and we start thinking and worrying. And then we start putting into action, you know, certain things and planning, and then we can get there to the behavior change. I always say that my most powerful thing that I can do is move a patient from a pre-contemplation, from not thinking about the problem, to actually at least realizing they have a problem. And that's huge, because sometimes when you get them to that stage, they'll find the power within themselves and work with you to find the solution.
So when we look at a person with diabetes, and my ugly, ugly pictures are behind those little cartoons, you look at vascular supply, and if it's not enough for healing, you may see a black toe. Infection, you have to remember a person with diabetes may not feel it, and they may not have the fever or the clinical signs, especially if their hemoglobin A1C is really high. And we look at plantar pressure redistribution. I look for the callus pressure, I look for the blister, friction and shear. And then if everything's okay, the best way to make a chronic wound acute is to do sharp surgical debridement. Mariam, we're at our last 10 or 15 minutes. Next. And I think when we look at Helen, you know, we had to deal with them all. But a person with diabetes has 20 times the risk of a lower limb amputation versus somebody without diabetes. And when we look at the lower extremity amputations worldwide, 25 to 90% are diabetic related, and 50% of them are dead within 5 years, and 50% have a second amputation. So if you look at the next slide, the 5-year mortality post-amputation, go back, go up, press it again for the circle. And it's worse, than, if you like, breast cancer in females, prostate cancer in males, or Hodgkin's disease. So it's a significant event. So next, the very first thing to do is to prevent that amputation. And thinking back to those Narayan principles, we came up when we were working in Guyana, not far from here, with the 60-second screening test. And you can look at this on PLOS. You can actually Google Sibbald and screening and you'll find it. And it's in other places as well. And on the next slide, you can see simplified 2012 60-second. Have you had a previous ulcer?
No.
Amputation?
No.
On exam, look for deformity, callus, blister, linear crack or fissure. Check the toe webs because there may be a crack or fissure. Look on the dorsal surface, look at the nail folds for any thickening or ingrown nail folds. Then feel or palpate dorsalis pedis, posterior tibial pulse. Do you feel this?
Yes.
Using the monofilament, tell me when you feel it.
Yes. 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 Yes.
2 negatives, we need 4 or more negatives for a positive test. Remember to do the other foot. So I could explain it and actually do it in 57 seconds. So it's something that any one of you can do. And click. And when we did 1,266 consecutive patients in the diabetic clinic in Guyana, 9% of them actually had a foot ulcer they weren't paying any attention to. And next. And what tests can you do in 1 minute? In 1 minute that 48% of them can be detected as high risk. And we got interprofessional teams, a center of excellence. We trained key opinion leaders, 15 of them, and we reduced major amputations 68 to 72%. And again, that's freely available online, Low, Sibbald et al., on what we did. And on the next slide, what you'll see here is when the center opened, we immediately had an effect on the amputations, press, and we went from 7.95 per month to 4.14. And it was the only center doing the amputations in the country. So we could go back in the operative records. Press. So we reduced them 48% from pre-project levels, but, next, we actually got, press again, you got increased admissions, 48 limbs saved each year, and this is continuing. This project was a 10-year project. It just finished this year. Next. And it's a 68% reduction because once they realized their foot wasn't going to be taken off, our admissions increased by 75%. Next. You should look at your feet. And fungus among us, look in the 4th and 5th toe web. And if you see white area, there's bacteria there. And that's a source of cellulitis in the lower leg. Look at the toenails, but there are 22 things for abnormal toenails. But if you see those streaks, and you see redness that covers around the sides of the feet, you should be concerned. Next. What's a Charcot foot? And what's an infrared thermometer? And this is something you all should know. Helen, help us.
There it is. Well, my both feet became disfigured, first the right and then the left. And I was told I had developed Charcot, which I guess are mushy bones. And they had to be monitored so that if they got inflamed, I would know to be off my feet a little. So I started using this thermometer, and it tells me the story. 5 degrees difference, I have to rest.
Okay, Mariam, what is it?
So certainly, Charcot disease happens in 0.5% of persons with diabetes. Some of the common risk factors that we talked about is loss of sensation, so they lose sensation. They have usually normal circulation. They may experience a trauma. Trauma could be what sets the foot off to have fractures, and they continue to walk and the whole foot collapses. They have certain distinct symptoms that occur with regards to heat. So all of a sudden we have a lot of inflammation. It's demarcated by insensitivity in that foot, instability of the joints, redness, heat. There could be a strong pulse, swelling of the foot and ankle, and on x-rays we can see a lot of subluxations and fractures taking place. Certainly Charcot is one of the deformities that's well recognized associated with diabetes, but what is really great is we're seeing that Helen takes charge of her foot condition and takes control, and that's what we're seeing here.
And hopefully you noticed those 2 feet didn't look the same. Thank you.
The key pillars of Charcot treatment is obviously early recognition. You can prevent the deformity from taking place. We need to offload that foot, take the pressure completely off, and certainly she was into that process, and prevent complications from taking place.
And this infrared thermometer, in an acute Charcot, it's 10 to 15 degrees warmer. If it's closed and hot, think of Charcot. If it's open and hot, think of osteomyelitis. Every once in a while, the 2 can coexist. And as the temperature normalizes, they can weight bear. But this is a perfectly preventable amputation, but it is not recognized. And these people, within a week or 2, lose their feet because as soon as they walk on it, all the bones resorb, and they become, just as Helen said, a mush. And on the next slide, there are 3 random controlled trials, evidence that if they use thermometers versus standard care, the high-risk people, incidence of ulcers 20% versus 2, 29.3 versus 8.5, and 12.2 versus 4.7. And these are cheap. They're used by mechanics to measure engine temperatures, electrician to find hot spots in the wall. And we validated these against the scientific standard, and that's published. Helen, tell us about it.
There it is. Well, my both feet became disfigured, first the right and then the left. And I was told I had developed Charcot, which I guess are mushy bones.
Okay. So I think when you want to make change as a patient, some of the things that you need to ask yourself is, what changes do I need to do? What would I have to do to make that happen? So we have to weigh it out. What are the benefits of the change? And what problems may occur if I don't change? And internally, if you weigh it out, you're able to make those decisions that would bring you and move you forward as a person with a condition to decide if you want to make that change. If you start reflecting on these questions, that's a step in the right direction to making that change.
The next slide has just got the change with the eye. Go ahead.
So these are some tips for you as a patient. You have to have the willingness to become involved, set achievable goals, become informed. This is your body, not our body as healthcare professionals. Become an active partner in your own care. Become a collaborator in your healthcare. So those are all important. If you come into it with that mindset, you're going to get a lot out of it. And those are some tips for you when you're thinking of changing certain behavior, is set SMART goals. SMART goals are, you're not going to change the world in one day. You're not going to move from 300 pounds to 100 pounds in a month. It's going to take time. So you need to set very SMART, specific, measurable, achievable, realistic, and timely goals. You need to start setting cues for yourself. I'm going to do this in the morning, just to remind yourself that this is what you're going to do. Use substitution. I'm not going to smoke, but maybe I'm going to chew gum. Not very exciting, but, hey, start to do that.
Hopefully it's sugar-free.
That's right, sugar-free. Find social support, your accountability partner, whether it's your spouse, whether it's your friend at work. Find somebody to make you accountable. That'll keep you on track. Set up ways to reward yourself. After a week, if I do this consistently, I'm going to buy myself a nice pair of shoes, maybe nice dress. Give yourself that reward. Be kind to yourself. When we're kind to ourselves, lots of things can happen.
So what if we told you, systemic control, look at the whole patient. A, B, C, D, E, screening for the high-risk foot, saves the system money. Every cigarette decreases circulation 30% for an hour. Check your footwear. Don't have any seams or holes in your socks, and use your thermometer. Mariam, what about Healthy Feet to take us to the end?
Diabetes Healthy Feet, a new program, is a program that was developed by the Canadian Association of Wound Care. It's actually a self-management workshop designed for lay peer leaders to empower others to adopt healthy behaviors around diabetic foot. It's really a peer-led workshop where patients, share their experience and they learn all about risk factors. It's supported through a portal.
And I know a good peer leader for you right over here.
Yes. And connected to the diabetes community. And they have monthly reminders. That program certainly is a very scripted program, and patients undergo this self-management education and support each other, and they become each other's accountability partners, which makes a huge difference. What we found when we evaluated that program, 97% of people made behavior changes. And part of it is because that education was delivered by their peer. They connected and were able to relate to their peers much more. This is an actual quote from one of the patients. Many times we tell our patients do and don't. But when they heard it in that group setting with their peers, they really learned how serious their disease could be. They really learned about their risk factors, and they understood what they needed to do. So the environment and the networking and sharing and social supports can make a huge difference. And really our takeaway messages from this presentation: as patients, you really need to be empowered and participate as equal partners in your management.
And they did a very good job today. I had very few victims.
That's correct. You need to take action to improve the quality of your life. You have to have the necessary skills, attitude to support yourself, and develop what we know as self-efficacy, which is the confidence and the knowledge to be able to do certain things that your healthcare professionals, as you work with them, recommend. And clinicians, you need to respect your patient's expertise on the disease. They know their bodies more than you do. One size doesn't fit all, so we have to tailor and cater our care plans to them and provide them access to having relevant information and appropriate programs. Jerry?
This is the message I want you to remember: systemic control, screening, smoking cessation, shoes and socks, and skin temperature. And there's a quote to finish us off, Mariam.
And this is a quote for clinicians. People may forget what you said. People will forget what you did, but people will never forget how you made them feel. Many times that's the key as clinicians. And as patients, we want to tell you, empowered patients will improve their health and effectiveness of the healthcare system. Thank you so much. It's been a pleasure for us to be here. Thank you so much for the opportunity. We appreciate it.
We get another round of applause for Mariam and Dr. Sibbald. So Dr. Sibbald and Dr. Botros, we do have a small token of our appreciation for you this evening. I was given very clear instructions that blue was for boys and pink was for girls. And the speaker gifts have been very generously sponsored by Kirk Freeport, so thank you both so much. So we don't have any time for questions, but I'm sure that all our speakers will be hanging around a little bit now for the cocktail reception. Very important feature, little change this year. You will have been given a couple of tickets when you registered. Those are your drink tickets, so you'll need those when you go to the bar. If you have a friend who might not be using theirs, you can, barter with them for theirs if you want. Another thing I forgot to mention, the minister reminded me, is we had apologies from the CIMDS this evening. Dr. Slutsky wasn't able to join us, but sent his apologies. So, how are you guys doing? Did you enjoy those presentations? Okay. I think it's fantastic that Dr. Sibbald didn't have too many victims, so good job. So tomorrow morning we start at 7:45 with breakfast, which has been generously sponsored. Hold on one second, don't go anywhere yet. Wait. Thank you. So tomorrow we have breakfast 7:45 till 8:30 a.m., which has been generously sponsored by BAF Insurance. If you've checked your program, you'll see we have a fantastic lineup of speakers for tomorrow and Saturday. You want to make sure you don't miss any of it. Our first presentation, we heard a little bit about it earlier tonight, will be Dr. Salih from Iron Shore Pharmaceuticals, looking at mental illness in children, empowering the parents, the caregivers, and the healthcare professionals. You'll have your opportunity to get your flu shot tomorrow. You'll have your body check opportunity. I think we'll have all kinds of fantastic things with our exhibitors. Make sure you stop by the Pinnacle Media booth before lunchtime tomorrow to sign up for a chance to win a really cool prize. They also have some really cool beach balls, so you can pick one up as well. And also, we've got some sessions tomorrow afternoon, our breakout sessions, managing cancer follow-up care and taking care of the elderly. Ladies and gentlemen, thank you so much for being here tonight. Please do stay and enjoy the cocktail reception on the terrace, and we will see you all bright and early tomorrow morning.